it's important on the eve of his upcoming retirement from UC Davis to take a moment to reflect on this extraordinarily distinguished career. Dr. Greenhalgh has been a practicing burn surgeon now for over 30 years. He is a quintessential quadruple threat in academic medicine. For all those 30 years, he has been on every other to every fourth night call, taking critical care and acute burn surgical call for that entire period of time. He's been continuously funded since 1992, starting with a small grant from the California Biotech Company. That has resulted again in continuous funding from the DoD, the Burn Association, Shriners, NIH, etc. He has written over 223 books and chapters, many editorials, including most significantly a single authored paper in the New England Journal. It's over 300 presentations worldwide. He has been president of the American Burn Association, the International Burn Association, and was a member of the American Surgical in 2006, has been a leader both nationally, internationally, and locally. He continues to serve on the Firefighters Burn Institute Board of Directors. He has testified in Congress related to burn injuries and contributes tremendously locally as well as broadly. In 2015, he was named the inaugural Helen Bart Endowed Professor in Burn Care. It has been a privilege to have him part of this department, and he has set the bar high for tremendous scholarship, clinical care, teaching, and community service. So it is a pleasure to turn the morning over to Dr. Greenhalgh.
Thank you, Dr. Farmer. Let's see. I am going to, looks like this. There you go. Does that look pretty good for you, or are you seeing both pictures?
We're seeing both now. You had it the other way before was better.
All right, sorry. There we go.
Perfect.
Well, thank you for the kind introduction, and it's been a great career so far. And I just have a couple disclosures. I just still have one DoD grant that's finishing up and one that's ongoing. And what I want to do is talk about, I've actually spent half of my life in burn care. It's hard to believe. 2 days, it will be 25 years at UC Davis. So I figured 25 years was enough. So I want to reflect on the changes over the years and give some advice on how to have a rewarding career and maybe provide some humor. So brief history, I was born in Syracuse, New York. My grandfather was the chair of the OB/GYN department at Syracuse University. My father was a general surgeon, and I went to a tiny college called Hamilton College. I went to medical school in Syracuse, and my plan was to go into private practice in Syracuse. And this is actually a picture of the lake I grew up on, the Tisco Lake, one of the Finger Lakes. And that's actually my father's sailboat. It was a very beautiful area. And there's this thing called a butterfly effect. Actually, I heard about this morning, but what it is that a small initial change, such as a butterfly's wings creating wind, can lead to huge changes. And this is actually in chaos theory that a butterfly's wings can cause a tornado in the future, at least in theory. So what happened to me, I was went to Cape Cod on vacation between first and second years of medical school, and waiting in line to get into a bar, and I ran into this woman who I actually married. And so I decided to go to Vermont instead. And so I went to the University of Vermont and graduated in 1986 from general surgery. And this was the old pyramid program. We had 6 interns, and second years it went down to 3 people. So it's basically different now, but now you have categoricals, don't have to worry about it. We actually had to worry about it. And these are my co-residents, Bill Chaffee, who is the chair at Brown University, and Roberta, who's actually just retired as a successful plastic surgery program. I went on to do a year of research in immune and nutritional effects on wound healing. And this is a picture I just from this spring, it's fall in Vermont. It's just a beautiful state, wholly different kind of state. And then I went to University of Washington and spent a year with Russell Ross, who discovered platelet-derived growth factor. And he asked me to develop a model of impaired wound healing. So I developed a genetically obese mouse model of type 2 diabetes and tested whether platelet-derived growth factor could improve healing. And then I did a burn fellowship up there. And another beautiful area, and this picture you could actually see from Harborview Medical Center of Mount Rainier. And so I was recruited to go to work for Shriners and University of Cincinnati in 1989. This was the upper one's the old building of Shriners, which was interesting because in the old days, they didn't want parents to get near their kids. So they actually had a hallway they could look through windows to see their children, but they weren't able to get near them. And then eventually they made this newer Shriners Hospital in Cincinnati. And unfortunately, it's now moved to Dayton. So thanks to Dr. Goodnight and Newt McCullough at Shriners, they're seeking a new chief of burns. The Shriners Hospital had been in San Francisco and had no burn program. So I went out to start the burn program at Shriners and continue the burn program that started in 1974 at UC Davis. So the first lesson is make good decisions. You know, sometimes small decisions make a huge difference. And if you can, choose a career that you love. Don't make a choice based on how easy it is, but do it based on what you like, because that's important. And then throughout your career, do what is really right. So I have some sayings that people have heard before. This is my Yogism. If you look at how we figure out who comes to residency, and everything's multiple choice questions, and there is always a right answer. So I was a chief resident, and I was trying to figure out a patient problem. And so I finally asked one of my professors, Dr. Pilcher. He says, "Well, Dr. Pilcher, what is the right answer?" And he yelled at me and said, "There is no correct answer. Just make a decision." And that's really true. And my Yogism is, when it's time to make a decision, make one. The other thing is get good mentors. I was very lucky to have 3 mentors, all who were past presidents of the American Burn Association. The first 2 are actually presidents of the International Society of Burn Injury. And I helped use their knowledge to develop my career. And I actually used their models to develop my program. So when you get asked to do something, maybe it's a good idea to say yes. Dr. Gamelli said to me when I was a resident, "Greenhalgh, I want you in my lab." I don't think it was a question, it was demand. And I said, "Okay." And instead of going into private practice, he kind of directed me towards research and an academic career and great critical care. Dr. Heimbach, one of the great burn surgeons who had developed Harborview Medical Center burn program, he said, "Hey, how about coming out and doing a burn fellowship?" And I hadn't really considered doing burns, and said, "Well, okay, I'll try it, see what happens." And then when Dr. Glenn Warden asked me to come work for Cincinnati and Shriners, I said, "Okay." And I've used his model of running the program for the last 25 years. So I was very fortunate. I was able to build a program from scratch. It's very rare that someone can do that. But I think for your career, it's a great idea if you can build something. Build something that you're proud of. Build something, if it's your own practice, your own name, whatever. Build something that's really good. And when I was asking Dr. Heimbach about whether I should take the job out here, and he had a philosophy and everything, he said, "Dave, if it flies, it's your baby. If it fails, it's your baby. In other words, it's your thing. Build it. If it fails, it's your responsibility." And it wasn't always easy. There was the first few years, which were very tough. I had some co-burn surgeons who didn't like what I was doing. And then they left, and I was alone for 9 months, and basically on call for 9 months straight. And I started thinking about, well, should I keep doing this? This is pretty brutal. But then I thought about the analogy of swimming across a river. You know, I was a pretty good swimmer, All I have to do is get to the other side and I'll have a good program. But as you're going along, the current gets stronger, and actually there's crocodiles in the river, and I'm halfway across. And I said to myself, it's just as hard to go back as it is to go forward. So I went forward, I kept going. And I'm proud because when I came here, we admitted about 180 burns. Last year, we're close to almost 800 admissions. So it's grown tremendously. And if you look at our average census, this is our average census, up to about 34 for a couple of years and still higher. We get up to 50 patients, and that's still with only 4 interns on the service. It's a very busy service. We're one of the biggest burn centers in the country. So the other advice is follow your own path. Now, I use the guidance of mentors, but I didn't do everything the same. I decided I'm going to go this way. I'm going to do it the way I want to. And that's a good advice. Try to do your own thing, follow your own path. And there's some things you can do. Choose great partners. I was very fortunate to hire Dr. Palmieri in 1999. Dr. Sen came 10 years later to work with me. And then 10 years after that, Katie Romanowski came with us. And so the whole team's been great. We all work together as a team. We get in the OR together. They're great partners. And so when you build a team, every voice should be heard. It doesn't matter. Maybe the housekeeper can tell you something. You acknowledge what they say, don't necessarily put people down. But you have to figure out how to get your team to accept your philosophy. If you get a good team, you'll have a better program. You can't do it by yourself. So you build a team. So I was very fortunate. Vicki and Catherine came out to me from Cincinnati. Catherine came out, taller one on the left. She's retired. Vicki's still with me after over 30 years, and she's helped as both nurse practitioners came on. At the university, we have 3 great nurse practitioners now and a whole team, and pharmacists, nurses that work with us. We have incredible occupational physical therapists. In the middle here, Ingrid is now going to be the president of the American Burn Association as the first non-physician president of the society. And then part of the building the team is party with the team. This is our team at the American Burn Association, multiple nurses, therapists, presenting papers. It's a party that we have together with fellows and physicians. And but on occasion we have a drink or two. Be a mentor. Dr. Vu, next to me on the right here, is the first fellow we had. And over the years, I've had 25 research residents and 31 burn fellows. Currently, we have Dave Wallace and Jason Hurd, our current fellows, and we may actually be keeping them for a while. So it's been great to see young people develop careers in burns, go on to become directors at other programs. That's what it's all about. More of our fellows, again, multiple fellows, and even some I got to become Sharks hockey fans. I've created a patron saint of burns, Saint Bartholomew. I was in the Duomo, giant cathedral in Milan, and I came across this statue. And it was done by Marco da Grate in 1562, but St. Bartholomew was skinned alive. And here's a statue, which is pretty incredible, that showing his musculature, and he's got his skin draped over his body. And if you look in the middle one, that's his face and his scalp that's draped over it. So I've kind of declared that St. Bartholomew is our patron saint. I've got a motto. We haven't used it yet, but I could say we heal with the best. We actually have burn team music, at least in my room. Dr. Palmieri doesn't like it, but anyways, I like it. Jethro Tull, good old rock and roll, thick as a brick, locomotive breath, a great name for music, Big Floyd. And actually Sam Miatke, one of our fellows, got this picture from Ian Anderson, who's the main thrust behind Jethro Tull, to send me a little note saying a picture and signed autograph. It was cool, really cool. Now we have a burn team album cover. Pink Floyd, Wish You Were Here. I mean, what could be better? Great music and how to take care of a guy on fire, and even a cartoon version from Get Fuzzy. And then you can do a lot of things with your specialty. You know, we try to prevent burns as much as possible. We've tried forever to try to put ourselves out of business. We've gone to Congress multiple times and met with the congressman. Here's some pictures of a couple of our Congress people. And we asked them for things. And Dr. Palmieri and I were together when we ran into Dr. Boxer and asked, not Dr. Senator Boxer, and said, can you give us some funding for burn research? He said, sure, we'll do that right away. And next thing you know, we had $8 million for the Department of Defense to give out as grants for research. And we've since been able to use those Department of Defense funds to go on and do lots of studies. Dr. Palmieri, Dr. Sen, myself, have all had Department of Defense grants thanks to just going to Congress and asking for funds. And I'm a believer in doing research. To me, the practice is great, but if you really do research, it really is a spice of the career. If you go on and do research, it's really cool that you can see, wow, I figured out some basic science about my practice. And burns are an incredible career to go into research because burn patients have the greatest response to injury that you can have. They have the highest metabolic rate. They can get as sick as you could ever be and still survive. And it still amazes me how you can go on and survive such severe injuries. Sepsis is the most common killer. All our big burns get sepsis. So we're dealing with that all the time. And scarring is fascinating. Just a matter of just a few days difference will lead to severe hypertrophic scarring versus no scarring, on how long it takes to heal will lead to that ultimate scarring result. We're trying to figure that out. Maybe someday we will, but we still have a long ways to go. And you know, if you're going to go into research, develop a partnership. I've been extremely fortunate to work with Kiho Cho, who's actually a veterinarian from Korea, and then went on and got his PhD, and he's worked in my lab for 25 years. He is the most detailed quality assurance partner I've ever had. He's got great science and he's a great friend. You know, I've been fortunate, Dr. Farmer since 1992. Actually, my lab started in 1990. We first looked at wound healing and growth factors, and we looked at mechanisms of impaired healing. Now we're looking at the response to injury and things as bizarre as retroelements, retroviruses, and how they affect response to injury. We've also had a great clinical research team. Mary Beth, Katrina, a bunch of the other gangs. Some of these are older and newer. We have newer people, but we've had a great research team that we developed with the help of the team. Dr. Palmieri has been involved with a lot of that too. It's been fabulous to get a great team to work together, develop a clinical research program. And some really good advice is to try to learn something every day. You know, be fascinated with the world. I had an ENT guy tell me when I was a medical student is that if you read at least 30 minutes every day over time, that really accumulates. You can read more than that, but I know you get tired after being on call, but 30 minutes a day, whether it's New England Journal or about your operation next day, it really is important. And if you're going to learn something, question dogma. You should change things based on what literature says. I'm so much dogmatic. I hate the wound vac and things like that, but it's okay. I'll let people use it. And the other thing is, if you really stop learning, there really is no reason to live. You know, the advances since I started are incredible. When I was a child, I had a book, and in the book, it was anatomy, and it had the thymus. We don't know what it does. And then when I was a resident, we really had no idea how bacteria hurt people. We didn't know what it did. We didn't know how wounds healed. And as residency moved on, we started to discover cytokines. There were Butler's paper about tumor necrosis factor, and growth factors just started being learned. And I met Stanley Cohen, who got the Nobel Prize, and he was a growth factor man, and how growth factors stimulate wound healing, get things going. And now we're getting into toll-like receptors and epigenetics, disposable elements. And what I've learned is that the more you learn, the more you realize you do not know, because Oh, you have a gene, you turn it on, but not all our genes act at the same time. You have to control them with basically epigenetics. So all those things get more and more complicated. So if you think of something, write it, okay? If you come up with ideas, maybe you should write them down, publish it. If you don't publish it, it's worthless. You know, I thought maybe I could do a consensus conference on sepsis and infection in basically 2006. So I did it. I had to do most of the work, but it's been published. And we've now looked at new resuscitation practices. And, you know, even simple things like I looked at the design of cups for soup and how narrow ones tip over more. And that put me on National Public Radio, CBS News to talk about these things. So if you think about it, write it, and it really gets out there. And if you get asked to paper, as Dr. Farmer said, write it. So I was asked by Dr. Longo, write a paper, and I did. It was really worth doing. And, you know, part of Burns, you get to meet the leaders of the field. Dr. David Herndon's been a leader. Dr. Heimbach met. Basil Pruitt was basically our godfather. I've met Charlie Baxter of the Parkland formula. It's really cool to see the leaders in the field and really work with them. They're great people. And you also, during your career, you get to travel around the world. Here I'm in China talking to people. Here I'm in Taiwan the day after a typhoon with Naoki Aikawa, who was the president of the ISBI from Japan, one of the big leaders in burns. It's really cool. Now I have some sayings. I've talked about them. You know, burns are horrible. We have horrible stories. And if you're worried about how horrible the story is, we have the saying, we didn't burn him, we just take care of him. So do your job. Then there was Greenhalgh's rule. So if you get a situation where you have a blood pressure on the cuff that says one thing and the blood pressure on the arterial line that's the other thing, Greenhalgh's rule is choose the one you want. It's worked pretty well for me. There's the anti-rule, which is don't overuse the cautery. So don't replace a burn with a burn. And then one time I had the unfortunate situation of taking care of a Jehovah's Witness and watch him with a big burn eventually die because he never took a transfusion. And so I came up with Greenhalgh sign. When your potassium is higher than your hematocrit, you don't do so well. There's a lot of humor. Plastics guys would like this. This is a true picture. This leech had finished its job and was trying to go to the next room, and we caught him trying to jump out of the next room. And this is during the Trump era, and this was down in Tijuana, Mexico, and said, you know, there were no walls, and picture of Trump. I thought that was pretty funny. But what you do in burns is you really try to optimize not only survival, but you want to optimize functional outcomes. This guy on the left, sustained burns as a 2-year-old, horrible burns to his face, 3rd degree, arms, hands. And you can see I came up with a new strategy to wrap a whole sheet of skin around the face. And he's happy with the results. He sends me high school pictures of how he's doing. It's great to see kids grow up and become functional despite severe burns. And on the hands and arms is a young woman. Here are skin grafts of 3rd degree burns. You can tell, especially on the palm, they're pigmented. But if you do it right, you can really have optimal functional and cosmetic outcomes. We deal with horrible things. We learn that if you wait long enough, all burns heal. This is a girl sent to us from the Philippines. She's only 16 months after her scald burn, and she's almost healed. You see how horrible it is. Her lips on her chest, her arms are pulled together. So what do you do with that? Well, you have to have the nerve to go ahead and tackle this kind of problem. So what I did is I cut off all the scars, started over, skin grafted her, and here she is back in the Philippines. I touch up some webbing. So we get to deal with really cool cases of Shriners and kids with horrible problems and try to meet them. Now, one of our benefits is you get to meet some celebrities. Here's the Schwarzenegger, Arnold Schwarzenegger coming to visit us. It was really cool. On the other side, this is the governor of the state of Sonora, Mexico, where we go down and do outreach clinics on a regular basis. She's there to meet us. Here's a secret I have to tell you, that you remember the Terminator lost his arm in that first movie? We came to Shriners to get a new one. So here he is when he bought the new prosthetic for his Terminator movies. Here's Jerry Rice. It was pretty cool to meet him. He came to visit us quite a long time ago. I had less gray hair and Paul Mary looks younger. Jerry Rice has the biggest hands I've ever seen in my life. No wonder he's a great receiver. His fingers are twice as long as mine. Again, we deal with horrible things, but if you deal with horrible things, you got to write them up, talk about them. So the ABC Daycare Disaster occurred in, I think, 2009, on June 5th. There's a daycare with about 125 kids under the age of 5 in a warehouse, and they locked the door, and the building next to it caught fire. And to get the kids out, one of the dads actually drove his truck through the wall. And you can see on the right, this is the picture that they hung on the daycare, thanking the Shriners for taking care. We took care of 10 of the kids. And getting 10 massive burns in a week when it was just Paul Mary and I and no fellows, that was a pretty tough week. And you know, burns are sad. These are marking the 49 kids who died. And in Hermosillo, they still have signs like just to see you for ABC. They don't feel like they've ever been repaid for the great disaster. But again, these kids came in, so the governor Schwarzenegger came to visit the kids. On the right, this is the first lady of Mexico to read to them. This young woman is some kind of singer from Mexico that came to visit us. So you can't forget the human side. We see kids with horrible scars, but they're happy. This is our first big burn that we had at Shriners. Stephanie, it's the early team when I first started here. Here we are later, she's happy. And also with her in the same car fire, Erica, who's now works for the California Burn Foundation. We've grown older and grayer, but they're still happy to be alive. Now we do see a lot of patients die. Burns are often a lethal disease. It's a horrible thing. So we help people get better, but sometimes we help them die with dignity. That's part of the problem. And I found this quote from a really great book you should read called The Idiot from Fyodor Dostoevsky. It's not about an idiot, it's about someone who has seizures. If you should read it, it's a fabulous book. But he has this one line, and on the gloom of my declining hour, chance a farewell smile of love may shine. So I'm getting older. So it's getting close to time to retire. And, you know, as you get older, you get more tired. You get health issues that pop up. You know, atrial fibrillation sucks. And you don't want to get sick. But one of the best quotes was from one of my professors at University of Vermont, who said, Dave, you know you're getting old when you'd rather have a bowel movement than sex. Now you think about that, that's pretty sad, but that will tell you you're getting old. I don't know if I'm there yet. You're more fragile too. So Dr. Palmer will love this picture. Here I am on my mountain home. This is typically one snowstorm and I'm clearing it off, but you got to be careful because if you fall down these steps on the side, you end up with multiple fractures. And as Dr. Jerkovich said, you get a different view when you're lying in a hospital bed and you're in pain, and get a different idea what it's like to be in the hospital. So retirement is scary. Can you slow down after working 12 to 13 hours a day? I don't know. Will I get totally bored? I don't know. Will my wife still tolerate you being around that much? I think she probably will. And you know, you really will miss the people you were around through all that work. You work so hard, you have great colleagues, they're great friends. So you'd have to enjoy life. And you know, this is, I've been great pleasure to work with Dr. Farmer. And this is Maggie with the check shirt here. She's been our CEO. She was our CEO for 24 years. They're hanging out in Kansas with one of the shrine leaders. We actually had a retreat in the middle of nowhere, Kansas, on a basically cattle ranch. Had a great time. Here we are with Shriners down in Tampa with Michelle James, who's our chief of orthopedics, Dr. Farmer. We get to go down to Tampa and have meetings at the Tampa Airport Hotel with the Shriners there. And, you know, what do you do to prevent boredom? Well, you find a hobby. This is a tribute to Dr. Humphreys, who, when she was an intern, I'm that old, yes, she was an intern to me. I was looking at these pictures of, these are trilobites, fossils from 250 to 500 million years old. It says, well, you're looking at bugs and rocks? And says, yes, Misty Dawn, I'm looking at bugs and rocks. I collect them. I'm a big fan of paleontology. Here we got some others that I've collected, some I found, some I bought. You know, so you start doing more things like, I like collecting, arrowheads. I do bonsai trees. So I love cross-country skiing. I was out last weekend, and hopefully I won't break anything. And we love to hike. These are views from near where I bought a house in Serene Lakes near Soda Springs. You can go on a 4-mile hike and get this view at Point Moriah. You can ski out there, or you can hike out there, and that is the start of the North Fork of the American River. Incredible hiking is so much fun. Other hobbies you can do. You can see I have a big camera lens. So one of the hobbies I've become really attached to is wildlife photography. So I've taken a lot of pictures. It takes time, and it's not that hard to do. Pictures of birds. These are, say, sapsucker, a Swainson sapsucker, basically a stilt. You get pictures of mammals from, here's just the very northern coast of California. But if you go to Yolo Bypass, right between Davis and Sacramento, here's a river otter. And if you go right behind Lake, basically Truckee, there's bears you can find. So I've taken all these pictures. This is a picture I actually took in Yellowstone, and some of it's luck. This is a wolf. This wolf ran behind our car, and I captured it. And pretty amazing, a male wolf running right by you. You don't get the opportunity to take these kind of pictures. So it's become a hobby. I like doing it. Here's some dragonflies, beautiful animals. Incredible how their wing structure is. And these are up pictures from around here too. Eagle up in the mountains. You can see he's got a trout. Here we are on Pinnacle National Park. That's actually a California condor I took a picture of. It was way far away. It's just not great focus. We have kites. These are owls. On the right, this single owl was in my backyard. These great horned owls in Puta Creek, so not very far. You can get pictures of great stuff. These are different kinds of sapsuckers, woodpeckers. So it's a great hobby. So hopefully that'll keep me somewhat busy. And then finally, people ask me, why do you do burns? It's a very difficult question to answer. I do like the clinical challenges. The burn patients aren't done quickly. They take a long time to go through the whole process, to go through the scarring. It can take even months to years to recover, not only physically, but mentally. But the science is incredible. We have the most severe injuries and can see people get better. The community is small, so I know burn surgeons all over the country and all over the world. There are no people who are sicker, but they are survivors. So I'll just finish up by saying this is why I do it. So this is a guy, my first double amputee from electrical burns. And I saw him a couple of years ago in Culiacan, Mexico. Very happy to be alive. He's got kids, he's working. That's why you do it. This little guy, 4-month-old, 70% burns from child abuse, dipped in hot water. He's happy. He's going to kindergarten now. This young lady, Dulce, 70% burns. You know, should she have a good life? Yeah, she worked for Shriners. She's got 4 kids now. She's very happy. This guy was a firefighter, fell to the roof of Modesto, stuck inside a burning warehouse. He's very happy to be alive. People wonder, I've taken care of over 20 quad amps. and they're happy to be there. They're doing well. He's graduated from Shriners. And you get this kind of guy. He was a frostbite victim from Greenland sent to us. He lost 3 limbs. And here he is. He's out surfing. He now lives in New Zealand. He's very active. You know, the spirit of these people to get better is incredible. Here's a kid from the ABC Daycare Disaster. They had horrible burns they got out there. And we see him in outreach clinic, which is a real great blast to go down to Mexico and see 80 to 120 kids during the day. And they're happy to be with you. This young lady here, another 70% burn. She's now a physician in Mexico. And you got to look at how cute these kids are. They're normal kids. They run around like nothing ever happened. She's got 30-degree burns to her legs, but she's happy. Here's one of our great kids, Jesus. He liked to play with matches. He got scolded for it. So what did? He locked himself in his room and played with matches. Burned his fingers off, horrible face burns, 85% burns. He's a motivational speaker now in college. What he talks about is incredible. So it's been a great career, but I don't forget my family. I've been married for over 40 years. My daughter, 32 years old. My mother's passed away, so they've stuck with me for all these years. Still wonder why I still come home so late, but they've been incredibly supportive. So thank you for a great 25 years working here. It's been an incredible career. So thank you very much.
Well, Dave, this is a standing ovation from all of your colleagues. A truly, truly amazing legacy presentation. Great talk, Dr. Greenhalgh. We have a few things. We're going to take a minute to embarrass you just a little bit more. But before we do that, I want to start, Dr. Jerkovich, if you could, we're trying this virtual thing, if you could show the award. We have a little gift that Dr. Jerkovich is going to hold up, I think, in front of his screen.
We just need to, maybe I need to do this.
But Dave, we just wanted to show while he's getting that together, and you're reading all the amazing things in the chat from your colleagues and your peers and your students, what you've given this university, your patients, everyone is just so outstanding. We have a small token of appreciation, which is a plaque from the department in the formal way. And then you can see Dr. Palmieri has snuck into your room there. And I take very little responsibility for what is about to happen. Dr. Palmieri.
Well, Dr. Greenhalgh, there could be no better colleague or partner to spend a career with. Your educator, your clinician, research, you've got the whole package. And this is something to help commemorate your time at UC Davis and your presidential address.
Oh, thank you very much.
From us, yes, there's really something more than paper in there. But Dr. Greenhalgh's address, when he was president, was about how Burns was like Humpty Dumpty. So in honor of that, we have given him some Humpty Dumpty paraphernalia, including a book about after the fall. Like that one.
Yeah, thank you.
Just to help you to celebrate your presidential address and see you actually were heard on your presidential address.
Well, thank you very much.
So Dr. Greenhalgh, we have no intention of letting you go too far away, far enough to enjoy your life and your family and your well-deserved retirement. And
Oh, I think I see it.
I think, Dave, you can see this, maybe.
Yeah, I see it.
This is a classic piece of crystal etched with the DNA model that sits outside of the primary teaching school here at UC Davis. And the words inside of it are an honor to your exactly 25 years of service to UC Davis, which almost to the day is today of 25 solid years. So we put the dates on here inscribed when you began and when you ended your time at UC Davis to be 25 years. So congratulations, David.
Well, thank you very much. It's a great honor. It's hard to quit, but after a while you kind of give it up, and I'll still be working at Shriners because I'd say I like the kids better than the 180 kilo adults, but I'll be around, hopefully do some research and try to slow down a little bit. So thank you for everything you guys have done for us.
The fantastic career, and again, great role models in retirement from Bill Pevick, and I suspect you guys can reminisce a bit along with Nihilus Young and some others who have made this transition recently. We look forward to your wisdom always. So again, we're not going to let you go too far. Please read all the fabulous comments in the chat, and we wish you all the very, very best in the time to come. Thank you again, Dr. Greenhalgh.
All right, thank you too.
Congratulations.
Couldn't open, so. I haven't seen the chat.